Thank you very much for this opportunity, and first, my apologies for being late. I know your prior talk was about smart cities, and I think I would opt for just even a moderately intelligent city because it took more than 2 hours to cross what was less than probably 15 kilometers. But it's such an exciting topic, and I think this idea of what the digital economy or what the digitization of our world does. If you think about most of the things in our world, I would contend there's 3 areas that have never had the full benefit of digitization. That would be the arts, education, and healthcare. And I think it's high time, and we all have seen a lot of efforts going on in the healthcare space. And I just returned from the Radiology Society meeting in the US, which, again, the major emphasis now is not about the technologies of the hardware for doing, clinical testing or image analysis and such. It's really about this idea of digitizing the healthcare world. And when I think about the experience that I've seen in healthcare, there's a lot of very well-meaning people, a lot of smart people in healthcare. But in the end, it's about the fact that we are operating healthcare systems in a very disjointed manner. In fact, I would describe healthcare delivery as a loosely stitched together set of cottage industries. But I think all that is about to change. So I think I'll share with you a few of the ideas around this. And before I start, I'd like to just give you a bit of a view of why GE has got a, I'm not sure I see the, oh, here we go. Could it be displayed here on the mic? Okay, all right, there we go. Give this one, there we go, okay. I'm going to talk a little bit about why we're so bullish about India itself as a company, what we see as the opportunities, also why the uniqueness of the healthcare system here in India is a benefactor to the rest of the world, why the Internet of Things can redefine the way we do innovation, and obviously how Internet of Things is going to change the healthcare space. GE is present in a number of industries. As you may know, our CEO, Jeff Immelt, was just here recently, or near the beginning of the year. And if you look at where we see the opportunities in India, they are far and wide. They're not easy, as many of you know, but I think the momentum is clearly on our side. And when we look at the Make in India initiative by the government, we are definitely a believer in that. And we see even more opportunity as we go forward. We just recently, in fact, were awarded the contract for the locomotive deal, which is about a $2.5 billion opportunity. But as part of that, it means be more local in India. So we're going to be setting up factories in Patna and expanding the manufacturing footprint here in India. As I said, we have plenty of places around the country. In the healthcare business, we've been here. We just celebrated our 25th anniversary last year as a partner with Wipro. It's been a fantastic partnership, and again, one that we see expanding even further. We also just opened this year a multimodality manufacturing plant, very large, about 68 acres of land in Chakan or outside of Pune. Where we're doing very high technology products like wind turbines and power turbines. And we, again, when we started this project, we had fairly modest, I would say, views of what we could do there. And internally, it's, as you can know, there's lots of places that we can do manufacturing as a company of our size. So there's a little bit of a sell job of why to come to India, and before we even opened the doors on this plant, it was already full. So we've already broken ground, in fact, on phase 2 of this. But I think it's just another indication that we see a lot of opportunities in India. We see a lot of ways that the marketplace is going to grow on its own, and of course, the dividend of the demographics here and the intelligent people that you can find in the marketplace to resource your operations, be that engineering or in manufacturing, we're also very excited by. I'd say the supply chain is still an area that we would like to see more activities, developing the supply base that it takes to really do some of these more sophisticated things, and especially I make a case for that in healthcare. In Bangalore, we have a very large campus for innovation, and I'll talk a little bit about this, and it's not to be too much of a promoter, if you will, or an advertisement for G, but I happen to think this is like the coolest place on the planet. As an engineer, my office is based here. I have a lot of fun. We have groups from every single discipline working in every part of the GE portfolio. But for healthcare, we actually have about 1,600 engineers, a good number of those being, masters and PhDs. Shyam Ranjan, who's here, heads that as our CTO, longstanding technologist and expert in a number of fields. And we're very much, we've been using this platform to support our business globally, but what is new to us or different about in the last couple of years is really focusing a portion of those resources on doing things that I would call are quite disruptive in the healthcare space. And I'll talk a little bit about what that defines around. And then we have a very large software organization there working on the Internet of Things and our platforms for digitization of the healthcare world. And again, if you put this all together, it's our largest innovation center outside of the United States. So while we have places around the world, our biggest group outside of the US is here in Bangalore. So let's talk about how we think about innovation and why we think innovation processes themselves are getting redefined. We all see the global economy of the last couple of years have clearly slowed down. It's much more unpredictable or volatile, both geopolitically as well as economically. We don't foresee that changing. If anything, it might get kind of worse. So I think it presents us with a different view of gone are the days of just keep plowing forward in a given direction and have some luxury of time, if you will, to have those things work out. Today, you have to be far more nimble. You have to be far more rapid cycle. We were talking earlier before I got on stage about the entire sharing economy that's happening. And my oldest daughter, who's 23 in the United States, just shared with me this weekend that she had her first visitor on the couch surfing. What the heck is a couch surfer? So this is, I think, their mentality of how they'll use assets of the future and what they're comfortable in doing. And they're very comfortable with uncertainty and things that you and I might find kind of strange. But I think the way in which they define their physical world is quite different than the way that, certainly I do, but even, 30-somethings are a step behind, in fact, if you compare what the 20-somethings are doing with their physical world around them. There's also, obviously, a huge trend around populism or nationalism, if you will. I was on a call last night, and we were going through every country in the world or major market in the world, and the governments around the world, really going for this nationalism or populism, which is going to present yet another set of challenges for us. It's a global economy, but every country wants you to pay the maximum bill, if you will. They want you to do everything within their country. They want to make sure that, this interconnected economy doesn't really, they don't like it if it doesn't benefit them directly. So I think that's another area of which the Internet of Things really does displace, where work is done, by whom, and at what cost. On the business side of that, as I said, we're working much harder at things that are going to bring productivity to whatever we do. And that's important because if you think about the emerging economies, and India is kind of this both developed and developing parts of economies, affordability is obviously inextricably linked to the expansion of these markets. And so anything that we can do to bring out costs, take costs out of systems, is clearly going to make opportunities for the market to expand, but also gives us a better position in these markets. And I think if you look at our innovation cycles, even 5 years ago, we would have been at a much slower pace than we are today. Still not fast enough probably for our shareholders' definition, but clearly faster than we were even just 5 years ago. So let's think about, and I'm sure to this audience you're very well versed in these things, but I think it's fascinating to see when you connect things, what happens? Because it's not as predictable as we might think. And I think it goes in a way that is not linear even. And so I think when we connected people, and all of us with our smartphones in our hands or our internet connections at home, we have in fact changed the way we run our personal lives. The same is going to happen when we connect machines. And today, a lot of the ways in which businesses transact with each other and transact with the end customer is getting completely disrupted by this idea that we have intelligence and insights into your behaviors, customers' behaviors, end users' behaviors, suppliers' behaviors. So I think this is another fascinating thing around the Internet of Things. And one of the recent articles showed that if you take 3, and we have a GE Capital as a credit card business, which, because of US regulations, we're having to sell, but they showed us that with 3 consecutive transactions of your personal credit card, anonymized, so we don't know who you are, but if you take 3 consecutive credit card transactions, with almost a 90% accuracy, we can tell who you are. That's kind of scary, but it's also gives you a sense of the collection of information. Putting it into an analytical engine can yield new insights into things. Not all for the good, but obviously gives us a completely different way to operate in the business. In our healthcare world, we have obviously lots of physical devices. They're very sophisticated devices. They have to operate in very, kind of unique ways in definition. And they have to produce, for people's lives at stake, have to produce very reliable results. But if you combine that with analytical insights, and forget about the clinical decision-making process, just about how the efficiency of a machine operates and the cost of that operation, tremendous ways in which we can bring down the cost of healthcare just through this idea of connecting these machines. Last week we launched the GE Health Cloud, which is destined to plug in about 500,000 machines, which will bring the information out of those machines and aggregate that, and then allow for digital analytics and things the sharing of information, the better insights into information, how you operate a machine to how you make decisions for patients, is going to, again, change the capabilities of a healthcare delivery process and bring costs out and bring the outcomes up. But we can replicate that idea across many different forms. If you look at healthcare alone, the amount of information, the digital exhaust, if you will, out of just a single hospital is mind-boggling. Every patient that walks in is a unique source of information. It takes, for example, a heart surgery would implicate about 150 different people in a healthcare system. So you think about, there's a fascination with this, and healthcare workflows are some of the most complex that you would find. It's much harder than banking, it's much harder than manufacturing, but it's not impossible. It's just the fact that all these systems that create information, in fact, some of them still paper, believe it or not, have never been aggregated in a way that would make them useful or more useful to us. So when people talk about healthcare and the Internet of Things in healthcare, it does sound like there's maybe the bulk of activity happening in healthcare at some level. But I'll tell you, the reason that sounds that way is because we've never done much with it. Unlike other industries which have had far more, years worth of efforts in digitizing their businesses, healthcare is one of those last groups, if you will, to get the benefit or be involved in this process. One other way in which the internet or the digitization is helping to advance the innovation process is, again, take the Internet of Things and combine that with the sharing economy concept. And we are looking at whole new ways to bring innovation to bear. There's traditional things, which is, as you kind of went counterclockwise on this, is, you start with your user groups and patients included in that, the suppliers that are part of what you're doing, the other technology companies around you in the healthcare space, or in our case, the industry of healthcare, and the nexus of telecommunications and the internet. I think, obviously, those come out. But because of that, we can also do things like crowdsourcing. We've had several hackathons here in Bangalore, which have been just phenomenal. The amount of ideas and abilities for people to rapidly prototype things today, again, completely has altered the way that we would have conventionally or traditionally done innovation. And we had a recent example of an idea that came from an individual in Indonesia who came up with a very clever way to do a portion of the turbine blade in an aircraft engine. And I think if you stop and think about this, here's somebody in a completely isolated, non-related place, but a smart engineer who had, an epiphany, if you will, to do something, mocked it up, sent it in, and in fact, after, fully testing that, we realized that's a much better way to do it. That'll happen hundreds of times over in the healthcare space, believe me. There's so many unanswered questions. As I said, it's a very complicated set of information, and we're only beginning to scratch the surface on what happens when you put the ability for these things to be multiplexed together to give us a better way to operate the healthcare system, and clearly a better way to make decisions for patients. And when we do that, we'll get better outcomes at lower costs. Precision medicine is personalized medicine. A lot of the discussions around this, where we will be as patients in the next 10 years is going to be dramatically different than where we are right now. And that is because of this idea of digitizing. And it's the digitization plus the advances of information or insights into the human body. The genomic information, the proteomic information, those two alone, but they're massive amounts of data, but those two combined with advances in the biological treatments, be those stem cells or be those other biologics, will radically change how we'll get treated. Our risk profiles, the ability for us to take populations, stratify those, and do things appropriate for the risk profile based on your genetic or your genomic patterns. So I think there's a lot there that is, if we just, in fact, only looked at that piece alone, we could keep ourselves, very busy for a very long time. But combine that with the actual delivery process, the workflows, the coordination of care. How do we keep people ultimately outside of the high-cost tertiary settings? I was just in the US with the Kaiser Permanente group, which is one of the largest networked hospitals, but also one of the few in the US model, at least, that runs a capitated model. So if you think about it, they go in and they say, I'll cover this room of people for X of dollars per head, independent what happens to you. So they do a lot of modeling on this. But then their incentives is not to do, they only want to do what's an appropriate, lowest cost, treatment of you. And again, that's where healthcare overall will go, largely based on the fact that you'll have a coordinated information pattern to follow and understand what to do. Why do we like India's healthcare model, or what value does it have for the rest of the world, is that it is very unique. It's a private, as you would know, private paid model. Patients pay out of pocket, therefore very consumer driven. It does have its underbelly of things that aren't good, but if you know the right person to see and the right place to go, you'll get world-class care, but you'll get it 1/10 the cost, almost without exception, as you would in the US as a comparable. And there's lots of good reasons why that's possible, but I think you can take a lot of the models that we've talked about, and that will make that possible in other parts of the world as well. Because a lot of the loss or waste, if you will, in the healthcare spend has to do with the lack of coordination and the medical errors that happen. So I talked about the launch of a cloud-based Internet of Things, if you will, for healthcare, and there's a lot of great activity going on. You can see what what IBM is working on. You can see what Google's working on, Samsung, Apple, Wipro. So I'll talk a little bit about what we're specifically doing and why we see the value in this. And that is, I talked about the exhaust of information coming out of a healthcare system. So our idea is, we created a platform actually in partnership with Microsoft, create a platform which allows for kind of device agnostic collection of information. Then take that and organize that information, and then allow analytical engine to be applied to that. And the platform that we've developed is called Predix. We're using that in other parts of our industry. So aircraft engines right now runs a Predix platform to monitor the performance of an engine and selectively, maintenance activities on an engine, which in that industry, time on wing, as they would refer to it, is millions of dollars differences. So they're using it in that way, but we're using it in the healthcare for the areas that I've laid out here. There's things that are related to clinical activities, but there's things also clearly that benefit operations of healthcare systems, and then also things like privacy and security of the data, which in the healthcare world is like banking. I mean, we're not only very sensitized to keeping people's personal information private, but also there's a liability there if we don't. So the other piece of this, which I think the beginnings of this obviously is for the direct users of the technologies, but I think the patient's engagement is another really exciting place in healthcare. Our behaviors, I mean, take our genetics, that's probably our biggest risk factor is our parents. But our behaviors are our second biggest risk factor. How we conduct our lives, what we eat, how sedentary are we, how abusive we are to our bodies. Those things are really, that's where we see wearable devices and sensoring technologies, but they are very predictive as to what will happen to you. You take those two pieces, you can combine that with highly predictive algorithms as to what you should do, when you should do it, to protect or extend your life. So that's the area that we're also, another business that we're working on is mobile and digital health. Sensing technology is very important to that, and just as an example, we've got a prototype now of an ECG machine that's a tattoo. So the sensors are a tattoo, they wirelessly communicate with a cell phone, and you can monitor one's heart functions in a very passive way if you're the patient or the person, but in a very predictive way if you're the healthcare responsible party. We talk a lot about healthcare costs, and I think if you look at any Minister of Health or government's finance department, it's such a sore point for them because it just keeps going up and going up and going up, and lots of attempts to bring it down. But I think the primary lever that we're all going to have to bring down costs of care is, in fact, the information and using that information to our advantage. And you can see models of care which are being designed around that, clinical outcomes being designed with that and with data-driven outcomes. We're also working, obviously, on affordable technologies, and I'll give you a few examples of things in that, which, by the way, I think is also very exciting, because we're even challenging our own assumptions around that. I talked about how we engage the patients into this idea, and us, by the way, in this room are ultimately patients at some point, and how do we link ourselves into this? And then across the emerging markets, I'll touch on this, but how do we develop the skills, the adequate skills to deliver healthcare? It's a tremendous gap. And so develop skills, but also how do we use the Internet of Things to extend that limited set of expertise that we do have in many of these markets. So I think I've talked about a number of these, so I'm not going to go into it. I'll just say that we're spending a fair amount of money to be an innovator in this space. And as a company, because again, we have a large population in the US, and the US healthcare system being the world's probably most expensive, as a company, we're also highly motivated to fix this problem because we pay $1.2 billion a year in healthcare benefits for the employees and retirees of GE. So if we could save 10% of that money, that's real money. And that's another reason why when we look at this, we're both a provider, but we're also a consumer of this, and we're very motivated on how do we engage in this system to bring down costs. These are the 5 key areas that we're working on, and I think again, each of these have a strong linkage to the information or digitization of healthcare. I talked about precision medicine, which is terribly exciting, and again, 10 years, 10 years from today, the way in which we get diagnosed and treated is going to be very, very different based on just the rapid advancements in this space. The radiology merging with pathology is another, I'm not going to talk about that in detail, but you take that information, and today they're treated very, very separately. There's even completely different departments, different academic programs and tracks. We don't link those two pieces very, very well, and I think that's another very exciting place. And even there's work going on that if I look at an MR image, and I look at it not in its spatial domain, but I look at it in its frequency domain, there's more information there. In fact, we can correlate that back to genomics, and therefore we can extract more information out of an image that isn't visible to us, with our human eye. And then I think on bioprocessing, the ways in which we're moving from, this is a tectonic shift, in fact, from small molecule, chemically compounded drugs to biologics, things that are big molecules that emulate your biological processes, and stem cells is another leg of that. The future of this is going to be, we will, digitally be able to understand what's wrong with you, and we'll have you come in, we'll harvest a few of your stem cells, we'll teach them what to do, we'll put them back into you, and that'll be your treatment. So I think there's, this when we talk about this, it sounds a little futuristic. It's really already starting to be used for certain diseases, and I think that has got such promise that no one would deny that that's the process of treatment as we go forward. I talked a little bit about the global, populism, nationalism, and that's triggering a far different view of localization and mobilization of the healthcare system. And as I said, we're very bullish about that opportunity here in India. One, because we've been here quite a long time, and two, because the healthcare model here in India provides for a great innovation process. And then analytics. I think I'm going to skip over in the interest of time. When we think about healthcare, by the way, while we are a technology provider, we're actually extending that model to be more of an ecosystem provider, because delivering healthcare is really a tough thing to do. And I'm going to move to just one example of how do we innovate differently. I talked about disrupting the cost structure of healthcare. When we started off with small devices, and we've graduated ourselves up to more complex devices, expensive $1 million type of machines, we tackled this idea of CT. CT is a great tool across the world. It's a frontline diagnostic tool, but it's still too expensive for many parts of the world. So when we launched this idea, could we build a CT machine that was less than 40% of today's cost? We've done this here in India. It's just a shining example. It's being placed out in the rural markets. But what's fascinating is it's also going to have a role in the developed markets as well, because instead of doing an X-ray, if you can do a CT for the same price, obviously it has a much better richness of data and allows you to position and triage a patient for less cost than in the past. So something that I think is an example. Telemedicine is another way of internet, and then doing devices that have intelligence built in and the ability to extract remotely, send that information to someone for expertise. So an example of using, we built an ultrasound, a very portable ultrasound machine, but actually has a scanning coach inside, has an interactive video monitor, but yet it's very, very cheap. So things that today, I think if you think about the way healthcare is done, this could be done by a midwife, an ASHA worker, yet backed by someone who's able to make sure that the quality of what's being done is done properly. But already the reduction in maternal and infant mortality has been huge in these projects that we've done. And we can extend that idea across multiple different areas. So future of the medicine and using this idea of Internet of Things, it is definitely, if I said one phrase, it's data-driven. It's going to be more data-driven than it is today. And that idea can be extended, as I've pointed out, in multiple different ways. So thank you very much for this opportunity. Again, we could probably talk all afternoon around the things that happen in healthcare, because it is a laggard. It is the laggard into the Internet of Things, but I think the pace of change and the interest level and the investments that go on in this space are tremendous, and again, our future as patients is going to be dramatically improved by this idea. So thanks again.